Monkeypox, now a national public health emergency. The White House declared it today as cases top more than 6,000 across the country. In a briefing today, the HHS Secretary, Javier Becerra, said cases are accelerating. According to the data from the CDC, the U.S. reported nearly 2,000 new infections in just the last week. The move comes as the government scrambles to find more vaccines. The White House reportedly held off on ordering more doses back in May. Officials said they worry that removing them from the storage would take years off their shelf life. Today, the FDA Commissioner, Robert Califf, said the U.S. will start dose sparing. He says that means giving 1/5 of a full dose under the skin rather than a whole dose into the vein. And while that is admittedly less protective than a full dose, the commissioner said the method is not unusual. He said he's confident in how the FDA plans to administer the vaccine. But in the meantime, the long lines for the vaccines continues. CNBC's Shamari Stone spoke with people getting the shot in D.C., where there are more cases per capita than in any state.
I'm concerned that people may become complacent and not get vaccinated because they think it may not affect them.
Chase Ford waited in line to get the monkeypox vaccine in our nation's capital. He's relieved to get the shot.
I feel so fortunate, so blessed, really lucky. I know that vaccine distribution has varied from state to state. D.C.
health officials say they have a limited supply of the monkeypox vaccine. They've given over 10,000 doses, but that still only meets 10% of the city's projected cases. Health officials say D.C. needs another 100,000 right now to be well stocked. According to the CDC, there are currently 257 cases of monkeypox in D.C., which is the highest number of cases per capita in the United States, and at least 6,000 cases nationwide with no deaths.
We know monkeypox is located throughout the United States. And so simply put, there's not enough vaccine to go around yet to be able to curb the spread.
The Biden administration recently purchased another 2.5 million doses, but some state and local officials don't know when the new doses will arrive.
We don't really have a clear timeline on when we're going to get additional doses. We know that this disease is continuing to spread, and we're doing our best to limit that spread.
Former Food and Drug Administration Commissioner Dr. Scott Gottlieb warns in an op-ed that if monkeypox gains a permanent foothold in the U.S., it will be one of the worst public health failures in modern times, not only because of the pain and peril of the disease, but also because it was so avoidable.
And regardless of whether you live in D.C., New York, or California, if you're at risk, you should get vaccinated.
Health officials say gay and bisexual men are at the highest risk of the monkeypox infection right now. They also represent 98% of the cases, but officials also add anyone can get the infection through close physical contact with someone who has a rash from the disease or through contact with contaminated materials like towels and bed sheets.